Quality Watch is an educational production of IPRO. Opinions expressed reflect the views of the speakers only and not those of any company or agency. This podcast is intended for private, non-commercial use only. Please visit ipro.org to read our full disclaimer and terms and conditions.
Welcome to Quality Watch, the podcast focused on healthcare quality improvement. Quality Watch is a production of IPRO, a trusted partner of federal and state agencies working to measure and improve the quality of healthcare for all. I'm your host, Dr. Edison Machado, Senior Vice President of Strategy Solutions at IPRO. In today's episode, we'll talk about school-based health centers in New York State, plus a new mobile application that's helping kidney transplant candidates connect with transplant centers, and much, much more. But first, a few quick headlines and updates from around the nation and here at IPRO. The public health emergency around COVID-19 ended in May. And this past July, the White House announced the formation of its Office of Pandemic Preparedness and Response. The office will be led by Major General Paul Friedrichs, a military combat surgeon who has served as a special assistant to the president and senior director for global health security and biodefense. This office will take over the White House response to monkeypox, COVID-19, and other emerging biological threats or pathogens that could lead to public health-related disruptions in the future. Severe weather this summer is impacting public health across the nation. On the East Coast, where IPRO and many of our stakeholders are located, seniors and those with respiratory issues have been at high risk due to poor air quality as a result of the Canadian wildfires. And a tornado that damaged the Pfizer factory in Rocky Point, North Carolina this summer could impact the supply chain for sterile injectable medications used by hospitals. And finally, a new study by Virginia Commonwealth University in partnership with the Center for American Progress finds that excessive heat has led to an average of roughly 234,000 additional emergency department visits in the U.S. between 2016 and 2020, costing the healthcare system more than $1 billion a year. Kidney disease is one of the leading causes of death in the United States. Since 2006, IPRO has been a Centers for Medicare and Medicaid Services End-Stage Renal Disease, or ESRD, network contractor. Today, IPRO oversees 4 of CMS's 18 ESRD networks. IPRO's 4 networks cover 13 states, impacting the care of 25% of all ESRD beneficiaries. Treatments for ESRD include dialysis, either at home or in a facility, but the gold standard treatment is kidney transplant. Transplantation allows patients to forego hours of daily dialysis treatments and resume a normal, active lifestyle. For those who are eligible for a transplant, there are many variables to consider. To help patients navigate the transplant journey, the IPRO ESRD network staff developed the Kidney Transplant Compare tool. The Compare tool is a mobile application that was developed in response to feedback from patients regarding what they wish they had known before starting their transplant journey, as well as the challenges and obstacles they identify along the way. Today, I'm happy to welcome Caroline Sanner, Assistant Director of IPRO's ESRD Network of the Southeast, who is one of the key IPRO team members behind the development of the Kidney Transplant Compare application tool. Welcome, Caroline.
Hi, Eddie. Thanks for having me on today.
Great. Caroline, can we begin by just having you give our listeners some background on the ESRD networks and what IPRO's goals are?
Yeah, definitely. So the ESRD networks are responsible for developing local objectives and goals. These goals and objectives support nationwide priorities mandated by CMS and the legislative requirements of Congress. The ESRD networks are required to conduct specific quality improvement and meet goals that are focused on improving not only patient care, but also their outcomes. This is done by ensuring that patients and providers have access to vital education and information. That work is being done across the kidney kidney community to increase and maintain positive outcomes, and that patients have the support to navigate their care and file grievances if they arise. The IPRO strategic goals for our organization, we really work to improve the quality and safety of dialysis-related services for individuals with end-stage renal disease. We want to improve the independence and quality of life of these individuals. We want to improve the patient perception of care, their experience of their care, and resolve patient complaints and grievances. Improve the collaboration between us, the providers, and the patients, and then improve the collection, the reliability, the timeliness, and the use of data across the different spectrums of ESRD care.
Thanks, Caroline. That sounds like some really important work. Now, what prompted the development of this application in light of, the charge that the networks have?
Yeah, so through assessments across the 13 states that we cover, there was an identified gap in patient autonomy and transplant center selection, as well as patient and provider access to transplant center information. Historically, patients would pursue transplant at their closest center, or they'd be educated about a transplant center by their dialysis facility. And typically, that would be the ultimate center that they'd pursue. For example, if your dialysis facility social worker was used to always referring to a specific transplant center, that could be the one that you were educated on more often. So while both avenues are not bad in any way, we did strive to support more healthcare consumerism and autonomy to empower the patient choice of transplant. And the way to do that was to create an accessible platform for patients and their families to learn about this information about each transplant center that was not readily available before.
Got it. Now, who was involved from the team in creating the application, and what was the process that you guys followed?
Yeah, so first, I want to say that the creation of this application was a true team effort. So the creation of Kidney Transplant Compare began actually back in 2018 in our Network 9 region of Ohio, Indiana, and Kentucky. So this area housed our still actively running Ohio River Valley Transplant Coalition, which includes representation from transplant centers and dialysis providers and patients from that area. The project was formerly known as Transplant Center Compare, and this included data provided by transplant centers in the region, as well as outcomes data from the Scientific Registry of Transplant Recipients, or SRTR. The version of this project or of this work was housed on our IPRO website, and the information from these transplant centers was initially presented via PDF. Now, through 2022, myself and my executive director, Vicki Cash, really brainstormed the idea of presenting this work in a more accessible, innovative manner and having a true compare feature so you could more easily compare the different transplant centers' data. In addition to those advancements, we also were interested in expanding it across all 13 ESRD network states that we cover. So the first step was data collection and transplant center buy-in. So we worked with patient focus groups to find out what patients wish they knew before starting their transplant journey, and then factored those data points in, amongst others, into an assessment tool. We worked to promote the idea in the community by discussing it with different transplant centers and shared the assessment tool across the networks in batches throughout the year of 2022. In February of 2023, we gathered an internal focus group of our ESRD staff, and we did have one patient representative from the community. We began to work with the IPRO development team to relay our vision for the application, and in exchange, learn from them what was capable in terms of the application's build and its features. There was also preliminary data cleanup on my end that needed to occur to ensure that the transplant center data was in a format that was usable from the development team. Throughout this work with our focus group, we created every inch of information that is present on the app today.
Caroline, thank you for that. It really does sound like it was a true team effort, given all the folks you mentioned there. Can you tell listeners a little bit about how the application actually, what it does?
So the Kidney Transplant Compare app is available across mobile device, tablet, or desktop. When you go into the Kidney Transplant Compare app, The home screen will offer you three main pathways. The first one is a learning portal. So this portal has different levels of information, such as what is a kidney transplant and is a kidney transplant right for me? This is for patients who are starting to consider transplant. And then we also have an options for your transplant journey section, which discusses living donation versus deceased donation and other advanced topics such as high KDPI kidneys. Each education page has national and our ESRD network resources available for instant use and download relating to each page's topic. The second pathway that we offer is when a patient knows they want to look for a transplant center to start their journey. Under the Search and Save Transplant Centers section, the user can actually search for transplant centers by location, their select medical criteria, and support services. For example, if you're a patient who is worried that your BMI is too high or you're too old to get a transplant, you could filter and search for facilities that meet the criteria that are important to you. The last pathway is the comparison feature. Under the Compare Save Transplant Facilities section, you as a user can compare multiple transplant centers by criteria that you're interested in as well. This is a way for you to narrow down and decide on one transplant center or more that you want to be waitlisted at.
Thanks, Caroline. Sounds like the application can do quite a bit. Does it specifically help a patient determine if they are eligible for a transplant?
So our motivation to create this application was to allow patients transparency of which transplant center will accept them or not in terms of eligibility. Patients can use the data in this application to guide them to a center that is best for them. However, the ultimate determination of eligibility is in fact up to the transplant center, and this will be decided on during a patient's evaluation process.
Makes sense. Now, is the application intended to be used independently by patients, or should they really use it in collaboration with their healthcare provider?
Right. So the application, whether being used across the mobile device, the tablet, or the desktop computer, was designed in a manner to support independent patient use. So patients who have a more challenging time with technology, for example, can also use it with their provider at the chair side. Lastly, all pages that show transplant center data, they do have a print feature if pen and paper is a preferred method of reviewing information for the patient. So there's a few different ways that patients can access it, whether it's independently or with the help of someone else. When designing the application, I did want to point out that we reviewed and rewrote the information sections many, many times to keep health literacy standards in mind. And we also included term definitions to define different criteria points and data points so there was a greater chance of understanding for all of our patients.
Got it. Thank you, Caroline. Sounds like a lot of thought and energy went into the design of the application. Now, staying on the topic of providers, how can providers use the application directly themselves?
So providers across the CKD realm and the ESRD realm of work can use this application to help them find relevant and up-to-date information about transplant center support services and the different selection criterias. With access to this information, the provider can be more informed and help the patients navigate this already daunting and very cumbersome process. Helping a patient find a center that is best for them can also increase compliance with the waitlist workup process and success getting listed on the National Transplant Waitlist, which also increases that facility's outcomes in the CMS goals.
Thank you, Caroline. You've given our listeners quite a bit of information. Just have a few more questions to go through. How often will the application be updated with new information about the transplant centers?
The transplant center data that was provided to include that patient selection criteria and the offered support services can be updated at any time by contacting us at the network through email, phone, or through the help feature on the application. We will be sending out an annual notice to our transplant centers to review their current data, and at this time they can request any data changes. And as far as the SRTR data or the outcomes data that we do highlight in the application, This is released every 6 months, and we will be automatically updating that internally upon receival of this notice.
Got it. Are there any other applications similar to the Compare tool that you've been describing?
At this time, there are no other applications that encompass all of the data that we provide that is currently available for patient use. There are sites that provide kidney information, outcomes data, waitlisting times, but none of those sites highlight all three of these areas, as well as transplant center patient selection criteria and support services.
Caroline, this sounds like a valuable tool for patients and providers alike. How can they learn more about it?
Patients and providers and anyone listening can learn more about this application by visiting our website, which is esrd.ipro.org/kidney transplant compare. This is our central hub website for all of our patient and provider flyers, our 3-part demonstration series where we walk you through how to utilize the application and more. You can also find the application on the Apple App Store and the Google Play Store by searching Kidney Transplant Compare or viewing the desktop version at transplantcompare.org.
Caroline, this application sounds like it has quite a bit to offer to the community. Are there any additional tools or information that the networks provide to these beneficiaries?
Yes, so the ESRD network has many, many resources available that you can access on our website for patients related to our different focus areas. We have information on treatment modalities, healthy living, reducing hospitalization and emergency room visits, behavioral health treatment, health equity, etc. These resources can be accessed via our esrd.ipro.org website, through any of our patient groups, and through their dialysis providers.
Thank you, Caroline. Appreciate the time you spent with us to review the Transplant Compare tool today. For more information on the tool, as well as the IPRO ESRD Network program, feel free to take a look at the Quality Watch show notes. It's time for us to crunch some numbers in our Data Watch portion of the program. We are recording this at the end of July, which means that many families and educators are already thinking about back to school. Many people are unaware of the existence of school-based health and dental clinics that provide needed services to students who might otherwise lack access to primary and preventive care. Since 2011, IPRO has been under contract with the New York State Department of Health to evaluate the plans for prospective school-based health centers and dental clinics, and to evaluate the performance of existing clinics. Here's what the numbers around this initiative look like. There are 252 approved school-based health centers in New York State located in schools that serve more than 250,000 students. IPRO conducts up to 80 monitoring reviews for these school-based health centers each year, and over the past decade has performed just under 600 on-site reviews. In addition, IPRO performs tracking and screening of an estimated 72 corrective action plans per year, and has provided technical assistance to more than 200 school-based providers. We look forward to continuing to support this important program as kids head back to school across New York State and the rest of the country in the coming weeks. That's it for this episode of Quality Watch. I'm Dr. Edison Machado, and on behalf of IPRO, thank you for listening. To learn more, visit our website at ipro.org. That's IPRO.org. If you've enjoyed this podcast, please leave us a comment and subscribe wherever you listen to podcasts. We will be back next month with more. Until then, we'll be working on better healthcare realized.